Hello, everybody, and thank you for previewing this presentation prior to our orientation. It is lengthy, but I feel like I have a lot of information to share, so I apologize for that up front. I'll be presenting today on our social emotional student support, and that would include our student support staff. It's a small staff, so that won't take long. And then I'll go into our student support teams model, which is the brunt of this presentation. And it is the model that we've utilized since last fall to support all of our students here at UI Reach. So my name is Kim Hanrahan. I am a licensed master social worker. I've been practicing for, 25 years or so in and around Iowa City. About 3 years ago, leadership at that time in Reach decided that staff and students would benefit from having a social worker available to them. And so I just finished my third year, so relatively new to the position. But I'm really enjoying it, and I absolutely love working with students and families. So I'm available to answer questions about social emotional support for families at all times. And also on my team is Kate Fox. She is a student support specialist that was hired fall or November of 22. So she was able to spend a part of last semester and all of this semester with us. She's proven to be invaluable. She works in the residence halls evenings and weekends to support students with immediate needs in their free time, and most often that is social emotional or can be. So she can either address issues that are emerging at that time or during that evening, but she also then is available to follow up with issues that may have arisen during the day. So, a student maybe was absent from classes but not answering the phone. So Kate can knock on the door and make sure she's okay. She or he or they are okay. She also supports or facilitates small groups. We rolled out friendship exploration small groups last semester along with relationship groups. So Kate's a master with that and very creative. Her experience is in the arts and mindfulness, so very valuable team addition. That is really it in terms of our student support teams. I would like for our team or core area to continue to grow and eventually be comparable to the other core areas that we have here. So academics, career and student life. I'd like to add our our student support team to that core area and continue to build and grow. Because what we're finding is that this is an area that students really benefit from having staff focus on how to develop friendships, how to maintain friendships, what does a good friendship look like, how do you decide who to be friends with. So that's the kind of support that all staff give, but then most especially Kate and I. The next thing I'd like to introduce to you is our student support team model. So this we rolled out in the fall. Prior to this, we were using the advisor-advisee model, which is where a staff person was assigned 3 or 4, if not more, students to advise throughout that student's tenure here at UI Reach. So they were responsible for all components and aspects of a student experience here, which could be overwhelming along with staff's regularly assigned tasks. So what we decided to implement is a team's approach to that. So we'll promote student outcomes through specialized guidance and supports, meaning that each staff can support a team in their core area specific to their specialized skill sets. It implements a positive model and culture focused on a student's strengths and goals. So in a staff person's core area, they'll be supporting a student in meeting the goals and the learning activities it would take to meet that goal in their area of expertise. We'll advance student abilities to access general UI and community supports so that students can gradually reduce their reliance on UI Reach supports and eventually rely mostly on campus and community supports, especially by the time they graduate from UI Reach. And it capitalizes on staff specialized skill sets like I've alluded to before. We feel like student support teams is a way to enable us to further achieve our vision and our mission, as explained here. There are a few guiding principles. There are many guiding principles, but I've just decided to highlight a few of them. We believe that all UI Reach students can be successful with appropriate supports. Teams develop strategies with students and not for students. So students are partnering with staff to understand and learn how their goals and dreams can be achieved. We help students see what's good for them is related to what's good to them. This one's especially pertinent as preferred lives are achieved, maladaptive behaviors decrease. Team approaches and support tend to produce better results, and each member of a team brings expertise and perspectives that support student success. So how do we get there? We do that by having interdisciplinary teams that I've talked about that will provide goal facilitation, guidance supports as needed, and then provide a level of support that meet the needs of the student where they're at. So some students will need a lot more supports, others will need much less supports, and that can be determined by the team. Really wordy slide. The next couple are pretty wordy, but teams are comprised of staff member from each core area and a member of leadership team to lead and guide that team. Each student will be assigned to a team, and then that team will monitor and contribute to the student's success in their goals that they've identified. They'll meet with students individually to provide support specific to their core area of expertise, and they'll connect students to campus and community supports as they deem necessary or as the team decides that it's necessary. So Kate and I will be assigned to the students that we've identified as perhaps needing more support than other students. Again, if we feel like if a student gets the supports that they need, that they can be successful here. For us, that usually means that we'll take most of the incoming first year students because that first year, that first semester is where we'll identify and get to know students and what their needs are, and then start implementing strategies to help them be successful. And then interventions and supports that they will need to help them be successful in all of their time here. So hopefully by the end of that first year, we've learned to grow and understand a student and what their needs might be, and have established that so that they can get the supports that they need to be successful throughout their time here. SSTs can be confusing, but we will spend a lot of time with students in the fall and with families, parents, or guardians to help make sure that they absolutely understand how this model works. But probably the most important thing to remember is that whatever the topic or area of concern or an issue that you're just a question that you have, who you talk to will be determined by the topic or the issue that you'd like to discuss. So let's say if it's an issue about classes or coursework or taking integrated classes, that would all go to the student support team member that represents the academic core area. And again, we'll review this with you more as fall rolls around. And then just to let you know that we understand that you are the student's expert. You know them much better than we do. And we will ask you for guidance and suggestions as we are getting to know a student and developing intervention or supports. That's irregardless if your student is their own guardian or not. And we actually encourage students to always include you when those interventions or supports are being identified and developed. I'd like to go through a list of the next slides will be what student support teams can do and what we absolutely can't do here at REACH. So we can encourage students to explore all of campus. We want them to have the richest, fullest experience that they possibly can. We don't want them sitting in their room constantly or, just not being brave and exploring. And so we'll support them and encouraging them and referring them to get them to those activities or events that are of interest to them. We can help with non-medical appointments. We can help with navigation or completion of initial paperwork. Very basic, as long as the student has that information at hand or it's available to us. We can support students with their schedules and use technology. So that first couple of weeks, we're really introducing students to the concept of their day-to-day schedules are on their Outlook calendars, either on their phones or computers or whatever device they're utilizing. So we can do that. And then we'll monitor campus leave slips. Leave slips are required if a student will be gone overnight, so that residents, all staff, when they're doing their rounds, know that that student is safe and just off campus. We can also assist in scheduling short-term counseling, either here at University Counseling Service or with a private practitioner. We can support during an emergency by assisting a student or supporting a student in either making an appointment, or we can get transportation for that student to an emergency room and meet them there. We can't transport, but we can then meet them and support them until a family member or guardian can come and meet with that student. We've already talked about connecting to on-campus and community events and activities, but there's also a lot of support departments on campus, and then we can monitor and discuss benchmarks. What we cannot do is address significant behavioral concerns, so mental health issues or medical issues. So it's recommended that a student who has had therapy or counseling prior to UI Reach continue with that, especially that first few months when they're transitioning to campus. It's hard to predict or determine how a student will respond to all the new expectations and responsibilities that come with being a first year student. So continuing that therapy throughout that time can be really beneficial. Again, we can't make medical appointments or monitor medication or treatment plans. We can't make diagnosis or treatment recommendations or even decisions on behalf of the student seeking support. We also can't be responsible for treatment decisions or transportation, care, or monitoring related to ongoing illnesses. We can help support a student in learning how to use our Canvas, our mass transportation system, but we just can't be responsible for ongoing support. We can't provide 24-hour supervision. Most of you probably already know that. We can't wake students up in the morning either in person or by calling. We just can't. Instead, we're trying to support that student in learning how to be independent in that skill. Sometimes it takes a month or two when they first come, but maybe starting that over the summer could be beneficial for a student, having them set an alarm, get up on their own, be prepared, get dressed, all of the things that you do in a morning routine that might help them as they transition to campus in the fall. And then grooming or personal hygiene, we just can't do that. We will remind a student, if a student comes to a class and it's obvious they haven't paid much attention to grooming or hygiene, we'll either, depending on the level of or degree to how bad it is, we can send them home right away and have them take care of it. Or we can ask residence hall staff to check in with the student in the evening to make sure that that's being attended to. We also cannot assist with room care tasks. That first couple of months, we do a lot of education, a lot of teaching students how to clean their mirror, how to keep their fork clean. Some need more support than others. Then again, that's something that you could start over the summer so that when your student comes to campus, they've already mastered some of those skills. We can't closely monitor purchases or budgeting or any of that stuff. Families can be very creative in how they manage this, either by putting a daily spending cap on. We have some students that come and they're not interested in spending any money, and we have other students who really enjoy shopping. So that's all up to the family, your family values, and how you choose to manage your student's budget. And then social technology and media, we just can't do anything with that. If your student is utilizing social media, we just ask that you help them understand the appropriate use of that. and how to be safe. I think they cover that in computers and tech to a degree, but you know your student best. So if your student needs support, please maybe help them manage that over the summer so that by the time they reach campus, they have that all hopefully figured out to a certain extent. And then I've developed, our staff has developed, a Who Do I Ask chart. And this is just a sample of that chart. So it's a list of common issues and then how to respond to that issue and what you would do if that were to happen. Students really pick this up really quickly, and students who are second, third, and fourth year students really enjoy helping first year students figure out like who they ask and who they go to. So either a student can follow this list or just ask someone that's in an upper class. So, and we'll be there. It usually takes a couple weeks to a month for a student to figure this out. Some it even takes longer. And then those are the students that we'll continue to support until they have this mastered. The desired outcome in the end is that we would like us, as students progress through their goals, they'll slowly transition from UI Reach Center support to community supports and campus supports. We were finding that a student really wasn't learning how to self-advocate, understand and recognize what their own needs are, and advocate to get some support in helping them manage those skills. So this really kind of is the reason for this new model, not only that a team approach is more beneficial, but really that students understand what their needs are and can identify them so that when they leave our program in their home communities, they already have some integrated supports that they can tap into. And that can be supported by our alumni specialist as well once they graduate. And that concludes my presentation. Any thoughts, concerns, comments, ideas we can discuss during orientation, or if you would like to reach out to me prior to that, you can at kim-hanrahan@uiowa.edu. So I look forward to meeting you and your student, and I can't wait till orientation. So thank you for listening to the presentation, and take care.